Assalamu alaikum, everyone. I'm Hassan Rauf, and I welcome you to this live webcast on the Masters in Healthcare Management and Innovation program being offered at SDSB. I also welcome our distinguished panelists here. So I'll quickly give a brief introduction, and then once we engage them in the discussion, then they can obviously share something on their backgrounds as well. So with me, co-host for this program is Mr. Kashif Khan. So he is executive in residence for this master's program, and he brings an immense experience, international experience in the healthcare management sector. Predominantly has spent most of his time in UK managing, actively participating in the healthcare sector there, and then has been pretty much active here in Pakistan's healthcare sector as well. Along with him, we have Mariam Zahid, and she's a healthcare policy expert and a researcher, and she brings the policy perspective to today's discussion. Along with her, we have Dr. Abdul Wahab. He joins from Shifa, and he is the quality director there. And he'll be sharing more from the process perspective. Where do we stand when we compare our landscape with international one? And I'm also honored to be joined by Dr. Rashid, and he is an orthodontist. And along with that, he's also enrolled in the healthcare masters here at SDSB, which was initiated last year. So now we are moving towards inducting the second cohort into this program. So I'll now invite Kashif Saab for his comments and to take the discussion forward.
Thank you, Hassan Saab. And it's a pleasure to be here and joined by esteemed panelists. I want to ask Rashid Saab from the start, what motivated Rashid you to the program?
Thank you very much, sir. First of all, for providing me the opportunity and encouraging me. Thank you, Hassan Saab, as well. Let me give my short introduction first, because as already Sir Hassan has told, that I am as an orthodontist, and I was working as a clinician since 2003. And when I started my very small practice, that grew organically, and like from one clinic to 2 or 3 surgeries. But it had been a constant realizing fact for me that for how long I can work as a solo clinician. So certainly it was in my mind that if I want to achieve more or expand my services beyond just as a single practitioner, because I was working at my fully saturated capacity. So I felt the need to enhance the capacity beyond this level. And for that, I was needing a team. And for the team, you need to have some leadership qualities, managerial qualities, and that's why I joined LUMS. Another thing which wondered me a lot throughout my life, that how these corporate peoples, the managers and the leaders at the multinational companies make people work better and give their best. For example, in McDonald's and many other multinational companies, who they provide healthcare products like medicines, pharma industry like this. So in fact, actually always been looking for such kind of managerial skills to expand my skills or to expand my services just beyond single one serving clinic. So on a larger scale, that was the main objective behind me to join this course. And when I came to know that it's all happening at LUMS, so there was no second thought for me to, I didn't give any second thought, and I joined that program. So that was the main reason, to expand my scope.
Thank you. That's helpful. We will return to that and explore further. Wahab Saab, with your esteemed experience of international and now working in Shifa, first of all, just give us, our audience, a bit more background to your career. And also, how have you witnessed the changing landscape of healthcare, especially in hospital settings in Pakistan over the last few years?
Thank you, Kashif Saab. Basically, I'm a physician by profession. I graduated in 2008 and started as a physician, but gradually we felt that there's much more need for hospital managers. We do have one of the best clinical experts in the country, and there's no shortage whatsoever of that. But if you look at the healthcare structure, the people who are managing hospitals or those people who are, basically responsible for the back end, there's a saying that 80% of the errors they say that they are because of the systems, and 20% are human interventions that resulted in that. So if you want to address the majority of the errors, you have to look and address how systems are being designed, or how systems are helping those who are working in that. So this was basically some motivation for me to move towards the management side. I did Diploma at American Board in Quality, then Certified Professional Healthcare Quality from USA. So majority of the certifications, even if you're listening, you know that they are from states. We don't have anything big, significant coming from our own country. The other problem that we have, the healthcare structure, as generally, as I mentioned earlier, it requires people to have not only the scientific, the clinical knowledge, but also the managerial knowledge, and at the same time, the nature of the environment of that country or the place, social dynamics, they all come into play a lot. Something that holds true somewhere else might not be working for you in your environment. So in this context, it's a lot needed program. Definitely, if we look at the healthcare structure, we only have like 4 or 5 hospitals that are recognized internationally. Aga Khan, one of them. Aga Khan is one of them. Shaukat Khanam, the 2 branches, and then Shifa. So if you go out of these 4 hospitals, you don't have anything that is recognized internationally. So I don't believe that we don't have good professionals, or we don't have good systems that can be incorporated, or that can be developed further. But what we definitely need at this time is that we need to develop our future generations, so this whatever is working can be expanded further.
And Mariam Sabah, as Dr. Wahab said, within hospital is defined. So you work in teams, and there is a need for it. And as Dr. Wahab also said, that this is one area where 80% of the investment required. How does that differ in public health with your experience?
I think when we see, especially since I am in this field since quite some time now, and I have seen this evolving, the focus of bringing the public health into practice, which was a neglected field early on. And if we see even the evidence suggests that the major improvements and in health does not come from new medical findings or cures, but it is from actually the broad development and application of population-based preventive programs, which is what a public health professional brings to this whole scenario. And even in this COVID pandemic, we see that the lack of information on public health became, a concern, and this was this had an undesirable impact, because we were caught in a pandemic where maybe health system structures were there, but the lack of having a public health preventive side, a solid or a robust knowledge of those structures did not exist. And this caused, because even emphasis on prevention, like hand hygiene and good hygiene practices, and the whole, actually, if you see the combination of this whole epidemic response could only be effective if we see that there's a combination of clinicians working with public health professionals. So the dearth of having such public health professionals became very evident during this pandemic, where we could see, and this gives the need of institutions like LUMS coming up with such programs and bringing public health in the forefront for this, because this is an important factor, which considering health is an important determinant of any country and economic prosperity of any country.
Other than public health, you also worked in creating the service standards for hospitals. How have you seen this evolve over the years? I mean, where is Pakistan's healthcare structures ecosystem together, in your opinion?
Because if we see that during the last 2 decades, Pakistan has evolved as a quality-focused, it is actually evolving into a quality-focused environment. And if we see that regulations have, since regulations and standards take a lot of time, and they have a lot of longer period of impact to show. If we see that development of minimum service delivery standards has been achieved in this time, and now after the institutionalization of forums like authorities like Punjab Healthcare Commission, Sindh Healthcare Commission, and then the federal health regulatory authorities, we are in the process of going towards regulation, which is a very critical component of everything, because whatever the health system performs can only be accredited once a certain standard or a minimum standard is achieved. So I think Pakistan is slowly, very gradually, is moving towards that, and the public health professionals, especially the healthcare managers, have a huge role to play, because not only do they need to know about the clinical practices and the clinical standards that they need to achieve, it is the managerial capacity that needs to be strengthened to that level to achieve those minimum standards or the essential package of health services.
And I think because your experience from studying abroad as well, when you did the MPH, how much emphasis other countries do on managerial side to create clinical leaders, people who actually can manage and lead the whole public health and health system generally, in your opinion?
I think most of the developed world obviously has a lot of developed structures for these institutions. Pakistan, in the historic, if you see the historic perspective, even till very later years, we did not have any management cadre. And public health or community medicine used to be one of the most neglected education, health education component, where we did not prepare the managers in a way that they could plan, we did not envisage those managers. Even till later, last 5-10 years back, we had district health managers who were just, who graduated from their tiers and became managers, if you say, by default. But having a special management cadre is something that the developed world has already achieved. And they are recognized institutions, and they are recognized courses which needs to be taught to those managers, and which is being done abroad. And in Pakistan, this is coming in gradually, but it's going to, understanding what a qualification a management expert for a manager, healthcare manager, needs to know is totally different from what a good clinician needs to be, a planner or a good clinician needs to have. So this is something that there are very good, I think, going through your even course program, I saw that there were very important. I was even, reading a Lancet report, which highlighted that for future health education and for owning basically the public health skill development, there are 3 main components that needs to be done. And I think your course highlights those. That was informative and transformative learning that basically bridges the gap between the science and the practice. And then training in teamwork, obviously, and interpersonal relations and technology. The focus on innovation and technology is, since we are living in a digital time. So I think this course provides that. And this is something that we're all looking forward to. Yes.
And Hassan sir, can you just add that probably be quite a good area, because one thing we recognize is there is a need for professionally qualified healthcare managers. What is it that, in your view, LUMS is trying to do through this course? What is the bigger vision for it?
So again, Basically, so there were quite a few programs that are being offered in Pakistan, but having interacted with practitioners in the healthcare setup, they were really not up there to take the standard up. So that was the idea. And secondly, since SDSB, the business school at LUMS, we've been focused, or the flagship MBA program, although it has a lot of wider dimensions, but over the years we have seen that program has not been feeding into the specific healthcare sector. So that's what pushed us to that SDSB needs to contribute. And looking at a broader picture, so countries which spend a lot more, because until unless you lift your education and healthcare standards, you can't grow. And that realization has to come in sooner or later. And because if it is spending is not done, these sectors are not enhanced, ultimately it ends up eating up your GDP.
Yeah.
So from that perspective, the idea was to develop focused managers and leaders who can go and contribute in that sector. So that was the whole idea in terms of an area which was lacking, and perhaps I will take up the responsibility for that. So that was the motivation behind designing and launching this program.
And I think WAPSA, as Dr. Hassan Saab said, there's an economic case for it, and there's also the social case for it, because these are the key areas. How do you think the healthcare system where it is now has the demand? Where are the demands for where the professionals are required in order to improve the healthcare industry as a whole?
If you look at the social aspect first, we know that whenever we are providing care, there are good chances that it might end up harming the patient instead of giving him a good outcome. So how does the good organizations, they control that? They have good systems. They have identified areas that are usually gray areas, or areas that are there where human intervention is causing problems. So they went back and studied these areas to address to reduce human suffering. This is how quality and patient safety realm is working towards. And the second thing, the economic part. Whenever there's a medical error, it is going to cost you and the patient a lot. There was some statistics. $1 spent for patient care is also $1 spent to reverse the effects of what we have delivered. So it's that huge. If we compare the number of errors taking place in healthcare, it makes it one of the riskiest business for anyone who is taking any benefit from it. Much worse than the nuclear reactor or any bungee jumping. Even bungee jumping doesn't cause that much deaths. There was to Errors Human, the Institute of Medicine report that claimed in US alone about 100,000 deaths occur every year from preventable medical errors. So if you look at all these things, definitely you would want to have a strong structured system which can prevent such happenings. So if you want a structured system, you need to have people who can, and system is basically people. People are the one who design the systems, and if people can design such systems that can reduce such errors, that is wonderful. So what we discussed even earlier when we were having a chat, that we need people to know what exactly happens inside the hospital. So they should know, and in each area of the hospital, so they can actually understand, if I do just one tweaking in one part of the hospital, my patients in other part of the hospital would be impacted, and many other departments would be impacted at the same time. It's not a linear pattern thing like any other industry. So and impact is on patients' human life. So we can't have people who don't understand the gravity of the situation, and for that matter, we need courses where people understand the complexity of the situation. So definitely there's a strong case for it, both socially and economically.
So Rashid, what Dr. Wahab just said, एक जगह आपका कोई bottleneck होता है, उससे पूरी journey patient की effect होती है. So with your experience when you went through this program, what were the key things that you learned as a both entrepreneur, because you wear the dual hat, you're a clinician, and for audience knowledge, you also teach as well. So what was your experience learning all those techniques and practices?
Yes, sir. The the very first thing when I joined the course, it is not usually common for the doctors or for the clinicians or consultants, because I was working as a consultant, to join such courses. But when you are managing, you are into the things of the daily operations, you realize that there are number of glitches in your daily work which put your efforts at stake, and sometimes patients, they do suffer as well. So when I joined this course, I felt that there is an entirely new word out of my profession, and it's again a huge science. So the learning, the daily life, I felt that there is the first thing which I felt that I need to be proactive in my approach and not the reactive. Tools like forecasting, lean, and scheduling, they helped me a lot. I was able to recognize the gaps and deficiencies mainly in my daily work. The first thing which I still remember, Hassan sir told me, what is the constraint? Like if you are working into 2 or 3 bay clinics or like these, so what are those areas where the patients and the journey of the patient will stuck, and you have to put up the more efforts. So I was not able to recognize those things before joining this course, and then I realized, okay, you can put on something, other things in the lean process by forecasting things, by scheduling patient, by scheduling your daily capacity, and by redistributing them in such a manner that you can reduce the wastage and you can improve the efficiency, and still you can you can avoid the unwanted efforts. With little efforts, you can make greater output, you can yield better products, and you can serve more to your patients. So that was the one of the very main important thing. I think forecasting. Then the other thing, when you are working in a team, like you change your scenario from traditional orthodox kind of leadership to a transforming, like you can allow your team members to work better and contribute better. That I didn't know, that how their thoughts can be that useful in that manner. So now I think I can beforehand plan, sort out things, anticipate my problems, and that me and my staff can face by using these forecasting tools, which Hassan Saab, Kashif Khan, and you sir, and Dr. Aisha, they told me. I'm really enjoying my work now, I think.
Yeah, all right. And how was the experience of networking with other industry students, because they all come from the healthcare background? What impact did they have on the course?
Yes, I think this is one of the very beautiful component of this program. The names, which I think I know them as a celebrities of healthcare. It was a great experience to talk to them. Having their sitting in front of you on the screens, and you can ask them direct questions. They are the big names of national as well as international healthcare service industry. So whether they are from entrepreneur, whether they are from pharma industry, whether they are from healthcare sectors, like the names which I think Abdul Wahab Saab has told, there are only few kind of hospitals that one can aspire to work there. For example, Agha Khan, Shaukat Khanam, and we had so many celebrities, and I must call them celebrities because they are celebrities for people like me who are serving in healthcare. To talk to them, to ask them, and to get their to get lot of expertise from their experience.
Right. So as a student, as somebody who's aspiring to join the course, what would be your advice? What are the key challenges, and what part they will find quite exciting? Somebody's coming from healthcare background.
Well, this program is a blend of many ingredients, I must say. For example, when I joined this program, I had, as I told, I had many questions in my mind, and soon after joining these courses, even in the first semester, the solutions to my many questions and problems, they were actually coming out. And the very first thing which I realized as a clinician, that I must know the patient is, or in healthcare industry or in a business, you can call them customers or clients. But then I realized I must know what do they want, what are their needs, how can I serve them better, and for what type of people I can be a healthcare service provider. So it gave me a sense that where should I position myself in the healthcare industry according to my capabilities, so that I can deliver my best to this sector. So then I came to know how to promote myself and where to promote, where to target right if I want to be an entrepreneur in the healthcare. For example, as I told, I wanted to expand my business, so it was in my mind. So I think these are the very common things which most of the people who want to join the healthcare industry and they want to prosper or want to progress, or they have their future endeavors and they want excel in that, they must know these, and all these questions, they have very good solutions and answers in this course. So I think I would definitely recommend people, clinicians as well as the people who want to come and join the healthcare industry. This is a brilliant opportunity, and especially when it is being taught at LUMS, there are world-class faculty available here. What else we want?
All right. Hasan Saab, given that you have experience of teaching management students across different sectors, what was your experience of teaching? Because you led the operations management, which is a key part of it, and teaching students who come from generally with experience and the background into the industry. What was your experience? And also, can you just shed light on the blended learning part of it? How did that help in the COVID situation as well?
All right. So the major challenge in terms of, so since the audience primarily belonged to the healthcare background, so the challenge was to make them take their clinician hat off and wear a process manager's hat. Yeah. So that was the key challenge. And because with due regards, obviously, because the whole idea is that it should be a team effort. We don't want the consultants or surgeons to be spending their time in trying to fix the processes. There should be process people who should be helping out them in these areas. So that's primarily the focus of the operations management area. And obviously, in order, when you see everything from a process perspective, yes, it may sound to certain clinicians a bit dehumanizing, but that's a fact. Until and unless you don't look at it as a process, you can't improve that. So obviously you have to look at, and Mariam Saiba rightly talked about that you have to start with information. Without information, you stand nowhere. And if we see the efficacy of drugs or COVID vaccines, everything starts with information. If you are not gathering information on your process parameters, you cannot improve those. So that brings in an interaction with the number world or the quantitative world, where generally people who have not have background with that area, it's not difficult, but it's generally our mental block which prevents us from exploring the depth in those numbers. They're simple numbers which are just out there. We just have to convert them into information. So that's where the emphasis lies, and that's where I think students initially struggle a little bit, but I'm happy that they coped up with that. And with that, I would also want to sort of bring back what Dr. Abdul Wahab Sahab said, and I would want his comments on that as well. He said that there are only 3 organizations that are recognized. So if he can share, what do you mean by recognized? And given that Pakistan is a country of 200 million plus people, so 3 recognized hospitals. So if he can share some light on the journey to catch up with the world.
Yeah, definitely. What I was referring to actually was the journey towards international recognition in terms of patient safety. The champions in patient safety, one major organization is Joint Commission International. There are other bodies like the Canadian or some local bodies like Sibahi, or in our case, we have developed some standards, as Dr. Mariam was mentioning, through Punjab Healthcare Commission and other commissions. But internationally, the most recognized is Joint Commission International.
Yes.
So once any organization wants to, touch that landmark, they really need to show commitment to the quality and patient safety processes at every level. From they're checking even the procurement, and not only the procurement, but how the manufacturing is being done at the original site. So imagine the level of scrutiny that we go through to reach these landmarks. And at the same time, the outcomes are being measured, as you mentioned. You need to measure everything. When I was mentioning the report, Institute of Medicine report, where 100,000 deaths were occurring in states in 1999, in that report, because of preventable medical errors, still we don't have any significant numbers in our country. So if we don't know what exactly is causing the problems, how are we going to address those problems if we don't know them? So I think if we need to progress in this direction, we definitely need to measure where we stand right now. We need to know that, and then we need to build on it, and we need to work on the identified areas that we have at hand. We can definitely start small, but we need to expand. 3 organizations or 4 organizations, this is not going to help the country in a long run. We need many more organizations. One of the challenges that we face when we are hiring new people, or when we are trying to expand into different different areas, we want to expand or open new organizations or new hospitals. One of the biggest challenges, how you will get new healthcare managers who already understand the dynamics of healthcare, who knows how hospitals function and what are the requirements. It's not a simple thing. It's a very complex. It's as good as you're building atomic bomb. It's not. I'm not exaggerating. It's as complex as that. And the problem with that is that everyone at in management position needs to know everything. So information, it's huge. And unless we have structured programs, to train our future generations, we can't keep up. We will not be able to keep up with the demands. So I would definitely recommend anyone, and especially LUMS people, to expand even more and get more people on board, because this is the need. This is frankly the need.
And again, the idea is to develop a platform where we can sort of share best practices, so everybody doesn't have to reinvent the wheel again and again. So that's the idea, where we can develop a collaborative platform where we can learn from each other, because by the end of the day, if the consumers or the patients or general population gets benefit, everybody in this country gets benefit of that. And for that, again, we'll be reaching out to everybody who can contribute in terms of because again, it's the second year we are into this program. It's still evolving. We need to further understand, focus on the areas with the key objective, so that the output or people who graduate, they can contribute based on the requirements. And another thing for which SDSB, the business school, is known is the participative learning, or the case method learning, that people who graduate, they don't have to go and do an internship to learn. So once they go there, they know what to do. They are implementers, they are practitioners, rather than somebody who would go and learn. So that's the idea, and for that we are looking for help, for assistance from people out there, so that we can further enhance the effectiveness of our programs here.
And to that degree, the weekend program, and I will come to Wahab Sab first, and then Mariam Sab, same thing. Clinicians are busy during the week. How do you think the weekend program would appeal to them? Because we now introduce the executive track, which is for those healthcare professionals who can't devote to full-time education. What do you think would be the attraction for that, and to get more people onto that sort of program? Wahab?
Yes, Mr. Kashif, I believe it would be a very good idea for those who are working because it's practically impossible to divorce yourself from an ongoing practice. It's quite difficult, I must say. And then you have to people are getting benefited from their jobs. So if we can offer them such a thing, it would be definitely helping them and helping us at the same time to develop a more knowledgeable community. So I believe definitely it would help them.
And Mariam Sawa, with that as well, in public health isn't sort of 24/7 operations. So you have traditionally you have a bit more. So how does that work within the public health sector, and generally to have option to work, study either full time or the weekend, both of them?
I think it's actually the need of the hour. This is how our day-to-day functions now, because people obviously like clinicians or public health professionals, they are busy during the week, and if an opportunity of a blended learning is there, I myself actually did my MPH from Liverpool with blended learning. So that gave me an opportunity to work in Pakistan and implement all that I was learning in my MPH in real-time work in public health work in Pakistan and studying online. And obviously, at weekends, the professionals can have a better time available to them for studying and practicing.
Yeah. And Rashid, having a mix of class where you have other healthcare professionals, and also during the pandemic, you had classes running online, then we had to move on campus, then we have to go back on. What was the benefit of having that blended learning? How did that help you to smooth out some of those unexpected variation?
Yes, Sakash, actually, when we are into health sciences, for example, in a medical college or in a dental school, it's a number of times we always meet similar kind of people all around us. And in LUMS, it gave me a lot of opportunity to see people from other fields as well. Because, for example, in my class, there were people like from pharma industry, there were people like coming from the healthcare commission, and some other people who were serving on the policy grounds, and some other from other healthcare segments. So it was a great experience. Plus the interactive sort of learning, where the groups we were in the groups where we shared our knowledge and interacted with each other, and sorted out the many cases, like Hassan Saab has told, that like case studies. So it was a great learning. It was a great opportunity, because it provides you opportunity to think out of the box, actually, to get your mind think more, and not on a like in a tube or in a tunnel vision for which you have been trained for many years. So it allows you to diversify your thoughts, number one. And number two, obviously, when I joined this course, obviously that at that time the COVID was at its peak. Uh, the Zoom thing and online courses, everybody, maybe they had in mind that it would be really difficult, but the way LUMS practiced this thing, provided the opportunity, it changed everybody's mind that anything can be taught online with the similar kind of flavor and the blend which can be offered at the campus. And later when we came back to the campus, again, it was a great opportunity. In person classes, they were little, one can feel the lacks that gaps were totally filled. And the sort of assessments, the assignments, they were very much streamlined, I must say. I didn't find any glitches in that. It was indeed a blended sort of learning along with my classmates.
Wahab sir, there's one striking fact about Pakistan, that 75% nearly of our medical students are female, and yet only a quarter of them end up in practice. So LUM started to offer 50% scholarship to female students into this program. What do you think we as alums can do, and what impact will that make to having more healthcare managers, because it provides you work-life balance? So what attraction would that be for those mass of our very talented individuals who have a passion for healthcare and devoted a part of their life to it?
Definitely, it's a great opportunity for anyone, not only females, for anyone who can't do the same difficult working hours of physician's life. It's really a challenge. We still believe those who are practicing. I'm not saying a bad word, but still they are in a house job, and anytime anything goes. So you have to, if you're a practicing physician, you have to be on your guard all the time. But if you're in management side, things are a lot relaxed, a lot structured. So those people who are leaving their professions after graduations or after completion of their degrees, high level degrees, and then they leave the profession just because of strenuous working hours. I think this is a great opportunity, and when we need it in the community, we already know there's a big need for qualified managers in healthcare. This is a great opportunity, and I believe especially women, they can get benefit from it.
Mariam Sabin?
Especially this is actually very interesting, because when we see the data from medical education, it's 75% of girls, and like you said, there's so much of iteration, and Wahab Saab has very clearly mentioned. And even if you see the scenario just changes when we see in the public sector. And when we actually see the percentage of women in health management, it's totally it's a turnaround. I think it's 75%, more than 75, 80% health managers are males, and there the opportunity, there's a huge gap for achieving gender equity. So I think it gives for any health system to actually work, for the whole population to actually be balanced, gender equity is required. But for health workforce, which is like the basis for any health system, HRH has been health resource for health, human resource for health is like a major building block in this, and having gender equity is of critical importance, because women are qualified, are there. You have medical women, females coming up, but there's unclear career path for them in areas where they can have a balance of work, family, and other responsibilities. So this gives a big opportunity and potential that LUM's course can actually harness.
All right. And given that we teach our students healthcare ecosystems, healthcare policy, research, regulation, politics, and law, one of the questions that keeps coming up, where do I go next after this course? Where do you see the demand for these qualified people within public health?
When I started off actually, I just came as an internee in this organization, which was just starting when I came here. And I never imagined, there was no career path that I was trying to follow. I didn't know that there existed any such career path especially for even like we were talking about medical background. I don't have a medical background, but I have public health. So that is also one opportunity that is there. So when you say this, organizations like ours, when we started off, there is amply open for, especially for females and for public health professionals to come in, because there's a huge gap of such qualifications and such expertise that is required in every field, because health sector is huge. And like you said, it's a sort of a multi-pronged subject, because here health manager has to be good in finance, planning, politics. Even politics is a huge component of it. And political economy is one of the fields that the developed world is focusing their, they're bringing it into health, and health political economy is one of the critical parts. So I think a health manager needs to be sort of a representative and who has the capacity of all these subjects. So this gives this is an important thing. Yeah.
Wahab Saab, last year when we interviewed candidates, one of the big experience, the passion for them to come into this program was their experience of hospital, the face of healthcare for many. And where do you think, with that sort of passion and learning from LUMS and learning what, as Dr. Hassan Saab said, the numbers and quality and everything, where are the options for them within hospital settings, large hospital like yourself?
Okay, if you're having a physician or a medical background, definitely you would be going towards the medical directorate path. So you can start off as a associate medical director or anything. You can start in that line where you're going to be responsible for most of the clinical aspects. If you belong to the other area with non-clinical background, then you'll be working more towards the administrative or the chief operating line. So chief operating officers, they are responsible for all these support services, and we must not undermine in any way the role these guys have. When we were talking about COVID, we were all, what saved Shifa, I believe it was everyone, all the experts of the field. We sat together day in, day out. We planned each and everything, support from all the admin side, and they guided us on every single step. Majority of them, they were engineers. They were, in admin side, we hardly have physicians. The majority of them are non-clinical people, and these people, they over time have gained further knowledge. They have learned things that the hospital requires, and in addition to that, experience from Joint Commission and other bodies. So there's a strong need for that, because again, as I mentioned earlier, if you are managing ER or managing one area of the hospital, you should understand the consequences of your actions at the other end of the hospital. Be it purchase, supply chains, be it managing radiology department, diagnostic services in other areas of the hospital, inpatient services. So these all jobs exist, and they are all for non-clinical people, majority of the cases. It's 50-50, I must say.
And Rashid, with your entrepreneur experience of it, what do you think those people who have entrepreneurial mind and they want to go into healthcare organization or set them up, what can they learn from this course? What was the biggest take for you from it?
Yes, sir. The first thing that I think it was I learned in very beginning in the first semester, that when you want to become an entrepreneur, you need to know not only what is the capability of your team, or you have the capabilities. Actually, you need to know what is the demand in the society, what do the people want, and how to target and address that thing in a more appropriate way. That is the major important. And certainly the funding things and financing, obviously that is a major part of the business as well. And without knowing the science of those numbers, those formulas, and those sort of skills, you cannot embark on to a certain business, or you cannot pitch on, right? So you should know these skills. Just having an idea that I can do this and this can work better in a society is nothing. You need to learn a lot more than that's what I learned from my instructors in this institute. And I think now I have clearer in my mind. For example, I was thinking just to expand my services. Now I think, what is the right place in this business where I can put my hook to rise on that castle? right? If I want to climb that wall in sort of this kind of business, then what is the right place from where I can penetrate? I think that was the important key to learn without wasting my efforts and without putting a lot of unnecessary funds and wasting resources. That's the most important thing as an entrepreneur I learned. Now I think I feel I can easily recognize, I can figure out what I dreamed into kind of a shape that I can sculpture out, that I can make. Now in my dentist, for example, I'm a dentist, and now I can feel that these are the areas where the society or the public or the people can look for the things. And here I can provide them better facilities or my services in this manner. And that will certainly be entertained by the society, or that will be certainly accepted by the society. And before learning these skills, it was just a sort of shaky, cloudy idea in my mind.
Kashsa, sorry, just cutting you. Yeah, sorry, I missed addressing your question. Where do they go from here? I think I didn't talk about that. Yes, I missed that question. I think organization like ours, where I'm working, where it's a public health consultancy, and Pakistan, when we started, did not have a lot of consulting work here, and there was dearth of technical assistance. So organizations like Contact has been, one of the we call it as a public health professionals nursery, because it's here. We have internees coming in from different PhD and master's program from different institutions abroad and in Pakistan, because when public health can only be, the skills of a public health person can only be harnessed if they are actually implementing in the field, which is practicing public health. Like you practice clinic, you have a clinical practice. This is actually the organizations, research organizations, think tanks, policy groups. These are the organizations, and obviously in the public sector you have institutions like Punjab Healthcare Commissions, or new health sector organizations that have come up. Departments are there. Then vertical programs have opportunities for public health professionals to join them. Then if we see in the development sector, if we see international agencies have opportunities for NGOs, INGOs, and then obviously the civil society organizations and research-based organizations, all these are in need of qualified and competent public health professionals. Yes.
Thank you. Hassan sir, as a faculty who teach last year, now you as a leadership role, what is your message for those people who are listening and they're still undecided about the course or the impact of that?
If you allow me, I'll come to this question a bit later, just bringing on the entrepreneurial part, which Dr. Rashid was talking about, you were talking about. So it's not the entrepreneurial or innovation part. That's not only for people who are looking to set up or expand their own setups. We need that mindset in our healthcare sector, because Pakistan is a resource-starved country. So we need people who can think of out-of-box solutions based on the constraints we have, whether that's financial constraints, whether that's human constraints, or social constraints. We need to come up with ideas to better utilize our resources. So that's where another aspect where we want the innovation and the entrepreneurial part to feed in. Now, coming to your question in terms of people who are listening, I think what brought me, because I come from the process side. I have a PhD in operations and supply chain, and for last 10 years working actively in the academic sector, also with industry people, helping them optimize their processes. So when this the entire discussion came up, so my motivation or passion came from where that's an area where we can add value or contribute really to the society. So any improvements that are made, or we can help, or by training people, once they go and they implement these improvements and ideas in this sector, I think that's something which we are looking for, and that helps us to put an extra hour every day, extra mile in our journey. So it's and so that's the human part of it. But on top of that, what Mariam Sahaba and Wahab Sahab have talked about, the gap, astonishing gap here in terms of, so if we have to improve, we need people. And so again, so if Shifa, Aga Khan and Shaukat Khanam are organizations which are targeting a certain level, they are also looking for people to join their team. So if that's the perspective of these people who are already up there, so you can imagine the scope in other healthcare sectors which are trying to enhance, or which are trying to move towards accreditation, which are trying to improve their processes. So that's the best scenario in terms of from job perspective, as well as something. This is an area which you can see your efforts being paid immediately when you when you look at people walking out of an hospital who are cured. So that's my message to people who are listening, or who are thinking about joining this program.
Yeah. And I think you're right. The big message where I see, and with my experience in healthcare, is that Pakistan is in dire need of people who are professionally qualified. We have resources, but we need people who are good managers, who are sound leaders, people who have that creativity in their mind and they want to make the system better for the patient journey. And by LUMS listening and responding to that industry need, and then as we moved to the executive track, where it allows clinician to have the work-life balance, so they can have a professional life which can be uninterrupted. We're offering the blended learning, where there is option for people to study online as well as on campus, because there is a whole LUMS experience. And then we offer generous scholarships, not only for 50% scholarship for female, but there are also 3 merit-based scholarships for 75% towards the fee. LUMS also offers the interest-free loan for those people who don't qualify for either of them. And what, from my personal experience, the whole LUMS alumni, the alumnites, you have a network of leaders across the globe who are at the pinnacle of their industry. And the vision for LUMS is to have the same level of leaders in healthcare sector across the globe who can benefit from this course, and then in ripple effect will make a difference to Pakistan's healthcare industry. In conclusion, I thank Dr. Wahab and ask him to have a few words at the end, and then I'll come to Mariam and Rashid at the end.
Thank you, Kashif Saab. It was a wonderful session, quite a lot of information for me as well, and it was really good sharing knowledge with everyone. As it has already been discussed, there's a serious shortage of healthcare professionals, managers in the industry, and the few organizations they have, they are producing their own managers and passing on to the the experienced managers to the next organization. But definitely we need to cultivate a culture or a habit where we have universities producing such managers that can fulfill the need of the community for coming years. Definitely, it's a much needed course. Thank you.
Mariam sir?
Thank you so much for engaging me in this insightful discussion. And I basically, on behalf of the organization as well, basically look forward to being part of this initiative where we can have, competent people coming from LUMS to experience the public health field in Pakistan, as the organization would be hopefully having some of the internees working with us. So this is something that we are looking forward to, and I would wish LUMS all the very best. And hope the standard is like, because the reaching the standard of JCI and CQI and preparing a professional for this is something that I think our alums can achieve. I would like to wish them in that endeavor.
And Rashid?
Thank you very much. The important thing which I want to say is that Pakistan is definitely in need of a lot of management in the healthcare, because we have health as a big burden. And we have so many experts. We had been very good doctors, well recognized all over the world, but still we have so many health problems. That means we are not good in organizations, and we are not good in managing our problems. So there is a gap, and people should come up with, there is a huge population of young people in this country, and probably the youngest nation. And there is a need from those young people that should come up with their brilliant minds and new ideas to serve this nation, especially in healthcare, to reduce the burden and to rise up as a healthy nation. And plus another thing which I must say, that this course helped me a lot, not only in my professional life, it helped me in grooming my personality as well, in my daily life, in my family life, in my peers' life, in my relationship with my patients, in my relationship with my other colleagues in my institutes, and it really helped me a lot. I think it brings out a more valuable person out of your personality, I think. Thank you very much for inviting me.
Thank you. And final words from Dr. Hassan Saab.
Just I'd like to thank our participants for sharing, for taking their time, and we look forward to their continued support, because we can't make this journey successful individually or in isolation. So we need support from people out there, and we need to do it and move forward collectively. Thank you very much.
Thank you.
Thank you. And with that, thank everybody. And I hope that we will be joining you later in another capacity. Thanks for your time.